Welcome to IRG's Health Talk. I'm Tom Hutler, along with Shannon O'Kelly, physical therapist and president of Integrated Rehabilitation Group, and our guest, Dr. Jonathan Drezner, sports medicine and family physician from the Sports Medicine Clinic at University of Washington Medical Center. Dr. Drezner also serves as a team physician for the Seattle Seahawks.
Dr. Drezner, thanks for joining us. You're a physician and you work at the University of Washington, like Tom said, and your interest is sports medicine.
Correct.
And part of sports medicine is we hear about these athletes and these young kids that have this sudden cardiac arrest. But before we get to that, let's talk about the heart and tell us how it works and why is it so critical that it's working right, I guess?
Well, obviously the heart's one of our vital organs in the body. It pumps blood and oxygen to our working muscles during exercise. So we need a good, healthy heart really in all of our physical activities. Occasionally, the electrical system of the heart goes haywire, and instead of pumping blood, the heart begins to quiver, and we stop moving blood to the rest of our body, and we might collapse and have something called sudden cardiac arrest. Sudden cardiac arrest, when it happens in an athlete, is often a catastrophic or fatal event unless we reach that person quickly with a defibrillator, which can save their life. And so we want to understand if athletes are at risk, if they have a heart problem. We want to know what to do if they do collapse on the playing field as well.
So take us back to that physiology class that you and I probably both enjoyed. And the heart, so you're saying the heart has an electrical system and also a muscular component. And you're talking about the electrical stuff. Tell the folks out there how the heart functions from an electrical standpoint.
Sure. Well, back to our physiology and anatomy class. So, there's 4 chambers of the heart, and to pump blood effectively out of the heart has to contract in a rhythmic way, much like you'd squeeze water through a balloon from one side to the other. And so you have an electrical impulse that causes the heart muscle to contract, push the blood out forward in an efficient manner, and that's how the heart pumps blood forward. But it's a two-phase system. It's the electrical impulse that's so important, and the contraction of the heart muscle that moves the blood forward.
So when you're talking about this sudden cardiac arrest that we hear about, particularly in young folks, athletes, because again, we pick up the paper and we hear about it, and a lot of times it seems like it's basketball players. I don't know, but it could happen to anybody.
Sure.
So what you're dealing with there, that's not cardiovascular disease that we hear about, like as you age, you get cardiovascular disease. So what's the difference between that and, I guess, sudden cardiac arrest?
Yeah, really good question. As we get older, when we hear about heart disease and cardiovascular disease, what people are usually referring to are the atherosclerotic sort of cholesterol buildup, plaques in the arteries that can cause a heart attack, or it can cause sudden cardiac arrest. A heart attack can cause sudden cardiac arrest, but it's actually a little bit different. A heart attack is when there's a clot within an artery or a narrowing of one of the arteries that gives blood supply to the working heart muscle, and that can cause chest pain or some other symptoms, and perhaps lead to an electrical short circuit that causes sudden cardiac arrest. But that's really not the main cause of sudden cardiac arrest in our young athletes. In our young athletes, there are a whole set of different diseases, often inherited or congenital problems that are from a structural abnormality of the heart, something like a cardiomyopathy where the heart muscle itself is actually abnormal or abnormally thick, or perhaps an electrical problem with the heart where that electrical signal doesn't move around the chambers like it normally should, or is predisposed to have one of these sort of short circuits and cause a sudden cardiac arrest.
That heart's a pretty fascinating organ. These folks that have this sudden cardiac arrest, are there any symptoms or signs? Do they know they might be susceptible?
Let's talk about adults first, because I think this is an important problem for them as well. In adults, if you're having chest pain with exertion, if you feel lightheaded with exertion, more short of breath than you think you should, walking up the stairs, feeling your heart race when it shouldn't, I would go see your physician, especially if you have some risk factors for heart disease. Diabetes, high blood pressure, high cholesterol, perhaps overweight, or a smoker. Those are really our big risk factors for that cholesterol type of heart disease that affects adults. In young persons and young athletes, some of the symptoms may be the same, either passing out with exercise or chest pain with exercise, but they often don't exist. And what unfortunately happens is you have a kid who otherwise looks healthy, and the first presentation of their heart disease is their collapse from sudden cardiac arrest on the playing field or on the court. And so we want to be really aware of what's happening to our body, but for our younger persons, a warning symptom is just not always present.
Yeah, those are the ones you hear about in the paper, and you pick up the sports page usually, and you hear about an athlete collapsing, and then unfortunately it's a fatality. But I'm curious, is there any screening mechanisms? Is there anything we can do or you can do as a physician during a physical maybe?
Yeah, there are, and I think we're all trying to figure it out. If you're a parent and you have kids, or if you're a kid listening to this, you have to have a sports physical and you have to have clearance by a physician before you can get on that playing field with your team. And then the question becomes, well, how do we do a sports physical? The purpose of the sports physical is really to detect underlying conditions that puts the athlete at risk for injury or perhaps a catastrophic event during sports. So what we want to ensure as a physician is their safety on the athletic field. The way a sports physical is done in the United States is typically a history and physical, and there are some specific history guidelines and questions we should ask about the heart as a physician. But I think our research shows that even when we do that well, we will miss the majority of kids who have an underlying problem, because the majority of kids who have one of these potentially lethal heart conditions have no symptoms. They have no physical exam findings. And so if we base our system solely on doing a history and physical, we're going to miss a lot of kids at risk. And so what we've done at the University of Washington and also through the Nick of Time Foundation is learn to use a tool called an electrocardiogram or an EKG, where we can look beneath the surface in some of these kids, get a better idea of the electrical signals of the heart, the structure of the heart, perhaps identify an enlarged heart, and find some of these silent killers before they're a problem. And so an EKG incorporated into the sports physical is something that is offered right now by sports medicine specialists or perhaps some cardiologists in the area. If you are seeing your primary care physician, it's worth a discussion with them to understand how your son or daughter should best be screened for an underlying heart problem.
So this EKG you're talking about, and just again for those folks listening out there, that tells you physicians kind of the electrical sequence, what's going on from an electrical standpoint of the heart. Does that test have to be performed? I mean, can it be done at rest, or do you have to get those participants that are getting tested, do they have to get their heart rate up?
Yeah, no. This is a resting electrocardiogram. So at rest in the office, we just want them relaxed, laying down. It's non-invasive. It's some stickers on the chest and on the arms and legs, and we get a 12-lead EKG. There are other tests, what you're referring to, like an exercise stress test. That's a better test to look for narrowing of the coronary arteries and the type of heart disease that affects adults. So a resting EKG in an adult is not necessarily our best screen for an older athlete, but in our younger athletes, the resting EKG can pick up a lot of these electrical or structural problems that may be a problem.
Now, if someone is found to have this electrical deficiency, if you will, how do you treat that? And I guess the question, can it be treated?
There's a lot of things we can do, and that's exactly our goal. Our goal is to identify kids at risk and then intervene with medical management. At times, a procedure, at times it's medication, or at times it's activity modification or even restrictions from sports. We know exercise can be a trigger for some of these individuals with an underlying heart problem. There are a variety of heart conditions that cause sudden cardiac arrest in young athletes, and within each individual condition is some spectrum of disease severity, and so often the treatment is customized to the patient that best keeps them safe with their physical activity, or perhaps best keeps them safe while they're still playing sports.
Wow. Again, this is great information. I guess one of the things I was thinking about as you were talking is there a certain age range or a certain gender specific, i.e. more males versus females, and again, the age range?
Yeah. It's hard to differentiate. I think that the parent says you want to get your son or daughter screened, male or female, no matter what age. Within the medical community, our science would say really beginning probably age 12 to 13, be it male or female, you want to get screened. The highest risk individuals in terms of sudden cardiac arrest would be males. There's also a higher risk in blacks or African Americans, and we seem to see this occur more commonly in certain sports, specifically basketball and football. And so perhaps if you meet some of those high-risk groups, you're more motivated. But I think really for any athlete, this type of screening process provides a little bit more reassurance that they have some heart safety on the playing field.
Wow. Once again, thank you for your time and great information. And as we wrap this up, I mean, if someone's listening out there and they think, I've got to talk to this physician because I have a group of kids I want to, have looked at just for safety, how would somebody get a hold of you?
Through University of Washington Medicine, they can go to the website for U.Medicine and look me up. They can call our clinic at 206-221-2443. And I also think they can get a lot of information through the Nick of Time Foundation, nickoftime.org.
Wow, good information. Thank you again.
If you would like more information on this topic, as well as how to contact Dr. Jonathan Drezner, go to irgpt.com and click on the Health Media tab, or go to Integrated Rehabilitation Group's Facebook page.